I'm Suzanne Goh, and this is a recap of the presentation on seizures in autism that I gave at the TACA 2015 National Conference. This is an image of an 8-week fetus in utero, and much of what is important in autism treatment has to do with understanding the root cause of the disturbance to brain development in autism, which very likely begins during fetal brain development. And the process by which the brain grows and changes from this stage up until it becomes a mature adult brain is extraordinarily complex. And we now know a lot about what happens to the brain in autism, and much of that we know through brain imaging studies. This graph shows the explosion in brain imaging studies of autism over the past 30 years, with only a few studies published per year in the early 1980s, to over 200 studies published in 2013 alone. So we have now over 1,000 brain imaging studies of autism. And there are many different techniques that have been used to study the brain in autism, including functional magnetic resonance imaging, which allows us to see the different parts of the brain that are active during certain mental tasks. It allows us to map the connections between different parts of the brain. It allows us to look at the chemical composition of different regions of the brain, as you can see in this diagram here. And we can look at the shape, size, volume, and other features of the structure of different parts of the brain. And what all of these different techniques have allowed us to see is that the fundamental disturbance to brain development in autism is one of an impairment in long-range structural and functional connectivity. That refers to a relative increase in the number of local or short-range circuits and a reduction in the number of long-range circuits that are connecting more far-ranging parts of the brain. This leads to a state of disconnectedness and disorganization. It occurs early in development, and we now know some of the mechanisms that underlie that disturbance, one of which is a disruption of synaptic pruning. Synaptic pruning is the process by which the connections between neurons is reduced. And so what happens is an overabundance of cells and the connections between them, and we know that this impacts function across social, language, motor, and sensory domains. This is a research study that we published in 2014. Bradley Peterson is a brain imaging researcher and was a colleague and mentor of mine at Columbia University. And together we reviewed all of the brain imaging studies of autism that have been published. And we found that there was evidence for disturbances to brain function and connectivity across many different learning and memory systems. So, for example, in those parts of the brain that are important for learning facts and events, and the parts of the brain that allow us to learn new skills and habits, and in other areas of the brain as well, for example, in emotional learning and other forms of learning as well. So, what this new body of research allows for is a much more sophisticated and advanced approach to autism treatment. And this is a very simple depiction of the model that we use in our center, which is that we draw from a range of many different approaches: neurological, biomedical, behavioral, educational, but all of these are aimed at a similar goal, which is to improve brain biochemistry, neural networks, and brain function. So what I'd like to cover today in brief are a couple basic questions before we move on to look more in depth at seizures in autism. So what is neurology? What is the nervous system? What are seizures? Why do they occur in autism? What can seizures look like? What tests are helpful? And what does all of this mean for treatment? So neurology is the field of medicine that deals with the diagnosis and treatment of disorders of the nervous system. And the nervous system consists of the brain, the spinal cord, the peripheral nerves, which connect the spinal cord to the other parts of the body, and then the muscles as well. A very important component of the nervous system are the sympathetic and parasympathetic nervous systems. The sympathetic nervous system is that part of our nervous system which is sometimes referred to as the fight or flight response. So it is the response that the body has to stress. The parasympathetic nervous system is, in a sense, the opposite. It is what is activated when the body goes into a state of rest and relaxation, which is sometimes referred to as rest and digest. They serve as yin and yang for the body's stress response. Some other key terms and definitions in neurology. One is neuron, which is the fundamental cell type of the nervous system, and the mature adult brain has approximately 86 billion neurons. Synapse refers to the connection between neurons, and one neuron in the brain has on average 7,000 synaptic connections to other neurons. The brain has approximately 60 to 100 trillion synapses, which makes for an enormously complex network. And a neural network is a group of neurons that is anatomically and functionally connected, that conducts impulses in a coordinated manner, and serves an identifiable function. And the term neuroplasticity refers to the brain's inherent biological capacity for change, which essentially is the formation and pruning of synapses, which are the connections between neurons. All learning depends on brain plasticity. Neuroplasticity is sometimes used to market certain types of therapies, but it's important to recognize that the term neuroplasticity is very, very broad, and in fact is a fundamental feature of the brain that underlies all learning. So a program that's marketed as targeting neuroplasticity, that in and of itself would not be a reason to pursue that therapy, because all therapies hinge on the ability of the brain to change and to learn, which is what the term neuroplasticity refers to. The features of the nervous system that enable neuroplasticity are actually also what make the brain vulnerable to seizures, and I'll talk more about that in just a moment. So what are seizures? Why do they occur at higher rates in autism? And what does that mean for treatment? We know that seizures are very common in individuals with autism. So the prevalence of epilepsy, and epilepsy is a term that refers to the occurrence of more than one seizure in an individual's lifetime. The prevalence of epilepsy in the typically developing population is estimated at 1 to 2%, and in those with autism has been estimated in some research studies to be as high as 46%. The prevalence of an abnormal EEG in the typically developing population is 2 to 4%, and in those with autism is estimated at being as high as 80%. So you can see that the rate of abnormal EEG and the rate of epilepsy in those with autism is much, much higher than in those without autism. Now, a seizure is defined as a transient, abnormal, excessive, disorderly discharge of neurons, primarily in the cerebral cortex. Clinically, it's described as an event characterized by paroxysmal, stereotyped, relatively brief interruptions of ongoing behavior associated with electrographic seizure patterns. I want to draw your attention to the aspect of the definition that refers to the interruption of ongoing behavior, because we often think of seizures as being an event in which there are dramatic manifestations such as abnormal movements. But in fact, what's more characteristic of seizure is that it interrupts an individual's usual ongoing behavior. And so it may appear simply as a lack of awareness, lack of responsiveness, or staring off. So epilepsy is defined as the occurrence of 2 or more seizures that are not secondary to fever, trauma, infection, or metabolic illness. So 2 seizures that are not provoked by some other physiological disturbance. And an abnormal EEG that term can be used to describe a variety of different findings on a test that we call EEG, which stands for electroencephalogram. An EEG may be abnormal for a variety of different reasons. It could be abnormal because a seizure occurred while the EEG was recording, which would be referred to as an electrographic seizure. That's a seizure which can be seen on the EEG recording. it could be abnormal because of the presence of what are called interictal epileptiform abnormalities. The term interictal means any time in which a seizure is not occurring, which fortunately is the vast majority of the time. Ictal refers to the time when a seizure is occurring. So if there are spikes, sharps, or spike wave discharges at a time when an individual is not having a seizure, those are referred to as interictal epileptiform abnormalities. And you can see some of them here. This blue arrow is pointing to a sharp, which is an interictal epileptiform discharge. These here are spike wave discharges, which are also an abnormal finding. There can also be interictal non-epileptiform abnormalities that might include disturbances of background rhythm, architecture, and this can be during either wakefulness or sleep. And so this is an example down here where this recording on the right shows a slower background rhythm compared to the one on the left. Why do seizures occur at high rates in autism? There are a few different theories. One is that the underlying disturbance to brain development impacts the brain in different ways. One is to increase the risk for seizures, so that underlying cause gives rise to epilepsy. And another, and at the same time, the underlying cause also gives rise to the symptoms of autism. Another theory is that the epilepsy, those abnormal discharges and the occurrence of seizures, impact the brain in such a way that then leads to the symptoms of autism. And in fact, it's very likely that both are true, that whatever is the primary cause to the cause of the disturbance in brain development can give rise to both seizures and the symptoms of autism. And at the same time, seizures and abnormal epileptiform discharges may disrupt brain function in a way to lead to or worsen the symptoms of autism. This is a diagram that I wanted to include here because it shows the complexity of how we categorize and how we think about different types of seizures. So the first main distinction in categorizing seizure type is to specify whether the seizure is partial. That term is interchangeable with the terms focal or local, which refers to a seizure that occurs in just one part of the brain, versus a seizure that occurs throughout the brain, which is referred to as generalized. And we'll talk a little bit more in detail in just a moment about these different seizure types, and I'll show you some examples. So what can seizures look like? How do I know if my child is having seizures? How do I interpret my child's EEG findings? And if my child has seizures, what other tests may be helpful? So I would like to illustrate the answer to some of these questions through a case. And this is a case of a 10-year-old boy who was diagnosed with autism at age 2.5 years. He had severe delay in social communication and language development. He also had fine and gross motor delay, and he had significant improvement with intensive behavioral and biomedical therapies, and his IQ was in the normal range. He had a history of episodes of altered behavior for 3 months. He was having 4 to 5 episodes per week. His head would turn to one side, sometimes an arm would raise slightly, lasting a few seconds, and he would stare ahead and be confused. Whenever there's a history of this type of atypical movement, there are many different possible diagnoses, which I've shown here. The movement may be a seizure, a stereotypy, a tic, other movement disorder, or it could be behavioral, meaning in some sense voluntary. And next I'd like to show you several examples of these different types of movements. And I will do so in the next recording, part 2 of this webinar.